Hi, and welcome to another edition of AI Impact and Strategy. Today, you're going to meet Rohan Malhotra, who is the managing director of a fascinating business that operates globally called Fixing Us. Fixing Us is a media content company that produces videos and other materials based on genuine stories, authentic stories of patients who have had various diseases and conditions and about how they improved their health. It started about 10 years ago with a very interesting story from a couple of young men and their father in the UK. The father had diabetes and cancer, and the sons were determined to help him get better. It resulted in an award-winning BBC documentary, and that turned into a very interesting company that Rohan is now the leader of. Rohan and I are friends. We were classmates at the London School of Economics in the LSE Cities program. Rohan, being an inveterate scholar, has gone on to get another master's degree as well. In the video, Rohan talks about how Fixing Us is using AI now, and particularly large language models, to mine their enormous database of video content for insights into patients and diseases and how patients respond when they are ill and when they start on the road back to health. It turns out that using AI creates a significant strategic advantage for the company, as you will see shortly. We begin with a 1-minute promo reel that Rohan shared with me, which explains how Fixing Us is fixing us. And then we continue with our fascinating conversation, which I'm sure you will enjoy.
We've experienced so much loss.
You want it to be fixed the next day, but you have to go through the process.
This is it. I have to fix myself.
We got to get this done because you're valuable and we want you here.
You got this.
All right.
Take time to invest in you. You are worth fixing.
What would I do if this was my brother or my mother or father?
You've got to tell people you can fix it, whatever it is.
It would be really great if my story could be shared with other people.
It is something that I thought I wouldn't be able to do again.
I can't say it was easy, but I can say it was worth it.
I'm Rohan Malhotra. I help lead an organization called Fixing Us, which is kind of a health innovation system that's built around recording authentic patient journeys. Essentially, really, it was just a patient journey that was funded by Kickstarter about 10 years ago. That was about two brothers and their will to save their father's life, who had diabetes and cancer, and they helped, in return for raising a little bit of money, they promised to record his journey by video. And they ended up going into remission, and it ended up becoming a BBC documentary and helped kind of change policy. And, you know, to be honest, I thought I was a good son until I met them. And then basically the problem they faced, like many people in the creative industries, is they created something, but they failed to capture the commercial or other value from it besides the actual policy change. And that's where I came in. I was kind of the boring guy, if you like. I've managed a bunch of businesses, but the one thing I was very good at doing was capturing commercial value. I, bought half the company. We kind of paid off the debts, and we started this journey to build this company. And it's evolved into something quite different to what it was originally. And essentially, we make content and we diffuse the content across the health system, and that's how we capture our value. And that diffusion is now taking different forms, and that's brought us into the arena of, I say AI, but it's really LLMs, large language models.
So how are you using LLMs?
We create content. And when we create this content, when you create a 5-minute video, you can end up with 20 hours of raw footage. Or if you create a half-hour TV show for NBC, you can end up with 100+ hours of footage. Yes, we kind of ask people to just talk. We do self-film footage. We get group conversations. We'll film them and let rather than just doing curated questions and answers, we give them guidance and just let them talk about their personal journey. We deliver all this content, but we have terabytes and terabytes, thousands of hours of footage that, thanks to advancements in cloud computing, we can store in perpetuity at our own cost, nice and safely. What if I transcripted the entire repository?
Wow.
And I didn't just transcript it, I put context behind it. And then we built an LLM in-house that could actually speak to this repository. And then we also built, as you'd understand, the context that could be applied within the LLM to give context to all of it. And so the touch points of data are in the multi millions. We learned enough during the first iteration to be able to create a second iteration very, very quickly.
What platform are you building it on?
We built a kind of bespoke LLM, and then we were using different AI models. So when we were testing whether to use Llama, Phi-3, DeepSeek, or the Alibaba one or whatever, we tested them, and then I thought, well, hang on, why can't we have all of them? Why can't we ask a question and have a drop down and then compare the responses? And so we went down that route. And then we subsequently found there are others. Because why put all your eggs in one basket? Because AI models are a little bit like cars. They're all designed to get you from A to B, but they all have their own features and strengths. And when you have your little AI model and you process the responses, you'll get certain answers. But when you increase the processing, certain tools come alive. Certain ones like DeepSeek only come alive so much because for some reason they're able to do quite amazing things with quite little bandwidth. But then other ones like Phi-3 wake up. Suddenly they can do, different levels of analysis when you start putting your, bigger chips and processing. So, but now we've created something that's quite dynamic, so much so that now we have two LLMs. And one LLM that was built with a adapted white label and one that's bespoke. And we're learning. And so we found that the name we gave it is authentic intelligence, which I can't believe wasn't trademarked. So we built authentic intelligence because obviously the repository was authentic.
Yeah.
And so what I found is authentic intelligence isn't going to be a product. It will be a selection of products, because depending on the processing power, entry costs and access of which changes on a monthly basis.
Yeah.
It's crazy. I mean, you often think that your default is, oh, we'll go with the tool that can give us the best answer. But the word best is so subjective, because if it's most detailed answers, if you ask 10, 20 questions, no senior executive's ever going to read that.
Yeah.
So sometimes those simpler answers, whilst less informative for an ops person, is exactly what a senior executive is looking. So we're finding that even the deployment of it has so many different layers. And we're in a weird world now where the thing that pays the bills is the content. But this tool, which helps us make better content and create all these new diffusions, is in a weird way more valuable than the rest of the business put together. But that's not the business. Yeah. I'm less interested in commercializing per se the authentic intelligence tool. I'm more interested in understanding the different types of value that it can generate before I try and capture it. Does that make sense?
Yeah, absolutely.
That made sense in my head. But all of this was an accidental innovation. We were a documentary. When I met them, we were a documentary that was gone bankrupt. Yeah. And now we are an international health organization that helps patient engagement and has a LLM-based tool that doesn't exist elsewhere. So
the output that you get out from your LLM, from authentic intelligence, what then do you do with the output?
And what we found is the use of this effectively allows us to give information to clients that they don't have access to, or the cost of getting is so much. So we're finding that we are now accessing new parts of the business early on in the process, if you like, upstreaming our existence using it. And I'm quite happy with that value, that I can, for a fraction of the cost, fast track the repository. And I'm interested in doing that because that will allow me to actually add another layer of proactive solutions to unmet needs for the business because I've already got something that doesn't exist and I'm able therefore to solve it. But the pharma companies love what we have. They love it. But their decision-making processes are slow. The only industry I know that's slower than pharma is academia.
Yeah,
That's
education.
not a compliment.
When you run the LLM, authentic intelligence, against your data, are you doing it in the context of a specific disease state so that you can like
Yeah,
aggregate
that's
understanding of the
that's a
patient
very good
journey?
question. Yeah, that's a very good question. We wanted to build the capability for it to speak to the entire repository, which is only a very, very recent capability for one of those LLMs. We had a study that was done across 7 countries, and I wanted to compare the stigmas that were flushed out and the prominence. And then, of course, we can then compare them across disease therapy areas. We're very big on tacit knowledge in our business. We want to capture stuff. Let's say AstraZeneca. We work with them across 15 countries. We are talking to their AI leadership, which in itself is very complicated. We entered their world in content. They will always see us as content until we start to diffuse this content. That's why I don't want to sell it. By me diffusing it for free, I will capture more value by establishing a tacit knowledge reputation.
So how are your clients using the content that you're creating in your classical business, and how are they using the content that you're creating in authentic intelligence?
So the content in the classical business is used in 3 primary ways. One, the easiest way is they use it to empower patients and to acquire patients, customers, whatever you call it, depending on what type of business they are. And so that's our, facing. That'll be everything from campaigns that we make content for to TV shows like, BBC, Amazon, NBC, things like that. That's actually, I originally, when we set the business up, I thought that was going to be the mainstay of the business. Today, that is no more than 15% of the business. It's very important. Like our first season on NBC got 69 million viewers. So it's not insignificant kind of numbers. However, the primary use of the business is the 2 other bits. So what we found is that when you make content in health, curated content, storyboarded content, a lot of people approach content for health the same way they do for making content for sneakers. And they don't think of it from that authenticity, the way you recruit, the content becomes a stakeholder mechanism. So we do that. And what it means is we can create content for health systems to recruit partnerships, collaboration, education, and that's really powerful. Disease awareness, and it means the content doesn't just communicate; it becomes ways for, like, we did our first UN event in New York in September because being authentic journeys, suddenly, the UN, the Wellcome Trust, these companies can become diffusion partners, because they're all vested in those journeys. And then the other way is internally. The worst jobs in a pharma company are the global executives, because whilst they run the company, all of those local markets are like internal clients. And essentially, they spend most of their time developing new things that they then have to sell into local markets. They have very little proximity to patients because they're not allowed to deal with them. So our content is a great way of making their processes patient-centric. And what it does is it expands collaboration and it speeds up deployment because now they're no longer dealing in static kind of data. So that's actually the corpus of our business now. We're speeding up the innovation and value capture across the systems.
What it sounds like you're doing, if I'm understanding correctly, is you're accelerating the diffusion process within the pharma company so that whatever is coming out of their central labs that's productized can be diffused into all of their global markets more efficiently. Is that correct?
Correctly, yeah, that's the core thing. And what we've done is the primary form of diffusion is stakeholder engagement and value creation.
Yeah.
And I think the reason for that is most people don't understand what innovation is.
Yeah.
They think innovation is to be novel or to be original. Innovation is the capture of, it's the commercialization of the invention. What our business is we essentially took a patient journey and everyone thought the content was the deliverable. But I found that the actual patient journey itself was a deliverable, and it can become a vehicle for collaboration. It can help you grow different things. It isn't just the fact that we've created a new diffusion. We've essentially created a diffusion that is the waste product of the core business that has now created something that's more valuable than the rest of the business put together. Now, that was certainly not my vision, but I'm very proud of that. And it's actually that thing, in terms of the answer to your last question, is how are we going to use that? I don't know for sure, but I think it will be to help our clients, because then we become truly invaluable in an otherwise commoditized marketplace. We become more elevated in their planning processes.
Okay, so
that makes sense in my head. Does that make sense?
well, let me state it back to you and see if I understand it right. So then we'll know. So basically, I'm thinking out loud here, but you were in the content business and now you're in the adoption business using the content.
Yes. Yeah, actually, yes, correct. Sorry.
You're an innovation accelerator.
Yeah, yeah. I'm not even sure it's about accelerating. I would say,
Well, no, it is because you're accelerating the adoption curve for,
yeah, or I'm creating a more fertile environment for innovation.
well, that's
Because yeah,
okay.
it is yeah, I guess the
Well, so
acceleration as
that's
well. I
both.
think I was
That's two
yeah,
things. One is speeding
yeah.
up and the other is broadening, potentially broadening.
I think one of my primary challenges is actually going to be, especially in this post-pandemic world where you're not having the same amount of face-to-face time with people.
Yeah.
It's actually getting that communication across. And I think that's going to be my primary challenge.
Well, so in the language that I understand, it's you basically are going to have to come up with a marketing message that reflects this deeper level of value that you're providing.
Yes. Yeah. And I think the biggest value of the business is the real not getting distracted. If you think about that World Poker Tour example, if you imagine the real flux capacitor of this business is not authentic intelligence. Authentic intelligence is amazing, but actually it's that innovation. It's the understanding the innovation system of the pharma companies, for instance, and the health systems.
Exactly.
It's about creating that, driving that. Everything we do, our thing can accelerate the health processes and the patent value capture and stakeholder engagement of healthcare.
Yeah.
And that's, as long as I stay true to that, everything else, if I get distracted because I've got this shiny little LLM, I think I'll miss what is really the true value of the business. Now, that value is only understood, even though we're doing it with all of our clients, it's only really understood by probably a quarter of them.
Just a resource that may be of interest to you is a book called Crossing the Chasm. Are you familiar with it?
Oh, yes, I studied it. My last master's was in strategic innovation management,
Okay,
and I focused on healthcare.
So that's adoption theory. What Jeff Moore
that's the term. Yeah. Okay.
So Jeff Moore took some work that was done by another academic and popularized it. And Crossing the Chasm is the popularized version.
Actually, it's funny you say that. Crossing the Chasm is really our biggest, that is it. It's the challenge, really. We have to.
It's your challenge, but it's also their challenge.
Yes.
Because they have to get their pharma innovation across the chasm of their both internal and the regulators and the market. So in a sense, you're a catalyst to help them get across the chasm.
Exactly. Kind of that book, in some level, reflects the challenge of my business. Every time we create a new innovation, there's a new chasm to bridge.
Yeah, absolutely. I mean, that's a descriptive characteristic of a field which is evolving and a market which is evolving and a society which is evolving.
And that's why I want to make authentic intelligence effectively for the near future free to our clients. My best way of overcoming the chasm of this business, especially as it is a recycling of a business that's already effectively paid for it, is to just give it for free and make it invaluable in an era where there is so much excitement and hype and misunderstanding, if you like, a misattribution of what AI is.
Yeah.
I need to just focus. And the good news is, if I go away from having to raise money, I can actually build the business instead of trying to market to people to give me money to build the business. The speed at which they're now diffusing authentic intelligence is a lot faster than they are my core business because of the excitement and urgency.
Yeah.
But I think it's also because of the innovation system. The innovation system that we drive is the most valuable part of the business, but a lot of people don't understand business innovation models.
Mm-hmm. No, it's fascinating.
Even though they're living them. And I'm now embarking on quantum computing to kind of, because I realize within half a decade, that will be the next required point for elevation, assuming we have sufficient data for it to even require. Because the problem you've got is we have a repository. Remember, the repository has been turned into transcripts, but we actually have videos. There are tools that can ingest video and generate insights, but they can't ingest terabytes and terabytes of video. Those kind of tools are probably sitting in-house at OpenAI and DeepMind. They're not going to be accessible by people like me at budgets I have access to for many years. But the reality is, our repository is in video. So Authentic Intelligence currently is using transcripts with those contexts.
Mm-hmm.
But in about 4 or 5 years, with our repository building, the technology will be there and suddenly we can leap. Then we will be able to do stuff. So I believe that will require a different level of learning. So, but it's amazing. I'm very proud that we grew this through the pandemic, and you will not believe how many people kind of have told us that what we're doing is not possible. Like, oh, it doesn't make sense. I don't get it. And you literally, it's like every time I get that, you just go, okay, it just kind of.
And then do you tell them, well, 69 million people watched our NBC show, so
Yeah, I don't. I wish I could, but no. But I remember there were people like telling us, "Oh no, you can't enter this market just like that." And I'm like, in my head, I'm like, "Watch me." We're ultimately a bunch of innovators doing our best to, doing our best.
Well, what I would suggest that you add to that is that the business is based on a profound insight. And
Yes.
it evolved based on the development of that insight in many different directions and dimensions that were not originally envisioned, but the content and the way that you create it and the way that people respond to it is what's leading the whole thing forward, right?
Yeah, it is. It is.
Hey, really, I love catching up with you. I'm so happy to hear your story. Thank you so much for sharing it.
Oh, brilliant. I appreciate it. Okay.
All right. Take care.
See you.
Well, I took a lot of insights away from my discussion with Rowan. I hope you did too. In particular, it's very, very interesting to hear how Fixing Us is using AI to extract valuable insights, valuable knowledge from its enormous database of video footage. And this reminds us of how many others are also using AI because of its incredible capacity to synthesize vast databases into insights that we can use to solve problems that the human world is interested in solving. It was also very interesting to hear how the business model of Fixing Us is evolving based on the capacity to extract insights from its data, which was an unexpected bonus from creating the videos in the first place and preparing them to be shared on many different media, including, as Rowan mentioned, 69 million people who watched a Fixing Us program on NBC in the United States.